I know that you are very pro getting, obviously, as you said, getting children, adults into the sun, and you were not a big advocate of sunglasses. And I just wanted you to cover that topic as well.
When I was growing up, it's probably before you were born, one of the things we never used sunscreens. The incidence of autism was 1 in 1,000, and we didn't know anyone who had it. We were out in the sun, and then very few people got melanoma from overburning and everything. And this big slip slop slap campaign came in, and everybody covered up. We had no rickets before that. Now they're measuring the success of the campaign by rickets appearing back, something that we abolished 100 years ago. Sunscreen is advocated in some part, like in England, and even I saw in Canada and in northern parts of the US, where they're all vitamin D deficient or their levels are very low. So I'm thinking vitamin D is such a powerful thing for you. Low vitamin D is involved in obesity, diabetes, Alzheimer's disease, autism. So when you look at all those, you think, well, is it good to block the sun out completely? So that's the skin part of it. Now you mentioned the eyes and covering the eyes or not. So this is the new bit of data that's on the website under the vitamin D, is that it seems you need light stimulation of the back of the eye to send a signal to the brain to turn on the gene that's involved in making the 125 dihydroxy vitamin B12. And so this is where vitamin D is separate in the brain to in the circulation. There's a separate enzyme that's working in the brain to the circulation. That enzyme is turned on by exposure to sunlight. Of course, that when we moved away from the equator, one of the things we went from very dark eyes to blue eyes, and we're trying to let more light in. And we know it's involved in myelination of the brain. So if you're worried about glaucoma and some of these other things, you only need glass. You could have clear glass because those wavelengths that do that are blocked out with glass. But you need the wavelengths that are involved in stimulating the back of the eye.